Hi, my name is Alex Royer, and I run Wazi, a digital mental health company connecting people with therapy services over their phones across Kenya and East Africa. It's currently estimated that 1 in 4 people in Africa will have a mental health condition at some point in their lives, yet 75% of people do not get the help that they need. This leaves an estimated 230 to 270 million people who will be untreated across the continent. Additionally, mental health conditions account for a higher percentage of the burden of disease than HIV and AIDS. In response to this enormous problem, we're seeing increased global spending on mental health, both from development agencies and through employer wellness programs. Global development funding for mental health programs was at $308 million in 2016, which was the highest in the 5 years prior. Additionally, $300 million is the estimated size of the sub-Saharan African annual workplace wellness market. With all of this, there are a few main reasons why people are not receiving the care that they need. Stigma is possibly the largest blocker to seeking care. Stigma can come from self-stigma, publicly stated stigma, and the fear of being labeled. Even for those who are able to overcome the stigma, therapists are difficult to access. Therapy resources are low in the country and are generally concentrated in urban areas, making them hard to reach. Thirdly, cost of therapy is prohibitive to most. At an average of 25 to 40 US dollars for a session, and 35% of Kenyans living below the poverty line, most people can't access the therapy that they need. Lastly, for treatment that does exist, ensuring impact is difficult to do, especially when the team is distributed throughout the country. All of these reasons are why we started Wazi. Wazi connects mental health service providers with people looking for support and advice in a safe, convenient, and effective environment. Wazi therapy services are available through a chatbot, currently on both Facebook Messenger and Telegram, which is similar to WhatsApp and common in Kenya. This is also that they don't have to download anything new. Through the chatbot, clients create an account on Wazi and have the choice of choosing an anonymous username, ensuring privacy and addressing the issue of stigma. Once the client has a username, they will then see a list of therapists, select the best therapist for their needs, and book a time that is most convenient for them. Once it's time for the session, the client can talk to the therapist over voice call, video, or text. We currently deliver our services in 2 ways. First is through our employer wellness programs, where employers across Kenya pay for access to therapist sessions through Wazi's chatbot for their employees. Second is our Wazi technology licensing, through which government agencies and NGOs use our platform to support and manage their programs, increasing impact and reach. Wazi has worked with 5 companies across Kenya to provide therapy services to their staff as an employee benefit. Through this model, employers pay for the use of Wazi, allowing each employee to access up to 2 sessions per week with a therapist. Directly before and after the session, we ask employees to provide a self-reported well-being score, which helps us track progress and maintain quality. We then provide aggregated and anonymous data on employee usage back to the employer. Through the employer wellness business model, we receive a tiered license fee from the therapy organization and a % of the commission every time an employee has a session. Secondly, through our Wazi technology approach, the Kenyan government is using our platform to power an initiative to provide free access to therapy for vulnerable populations. Some of the key population focuses are youth, LGBTQI, and maternal health. Therapists specialized in working with these populations hold sessions with beneficiaries, and Wazi delivers globally recognized mental health assessments. We can then track how beneficiaries are progressing using a dashboard to measure program effectiveness. Over the span of 6 months, we expect to reach around 10,000 beneficiaries and plan to expand into a longer-term partnership. Through the technology licensing model, the NGO or organization pays a license fee based on the number of beneficiaries and number of therapists. Globally, the number of mental health companies is increasing as focus on the sector grows and people become more familiar with digital wellness. As a technology platform, we are uniquely positioned to partner with many global organizations as possible to consolidate efforts and increase our reach, including through partnerships with organizations who have historically not focused on the digital aspect of providing their services. We are committed to the privacy of our members and are constantly exploring ways to ensure security at the highest standard. Some initiatives we currently have are allowing users to be anonymous, SSL encrypted API endpoints, and the ability for users to delete personal data. Through 2020, we are focused on learning to scale across Kenya and East Africa. We are heavily investing in our technology and are learning and iterating based on our experience and feedback from partners and clients. This year, we aim to maintain a client retention rate of 40% and aim to expand this across 4 partners. In 2021 and beyond, we're planning an aggressive expansion across Africa and other developing markets. Our focus will be on marketing our solutions more broadly, with an aim of having 10 mental health partners along with maintaining quality and impact as we scale. With an infusion of capital, we are heavily invested in scaling our programs more efficiently and cost effectively as we increase access to and impact for beneficiaries. Focus 1 is being available on the most convenient platforms for our beneficiaries. With that in mind, on our roadmap are 1, a progressive web app, 2, integrating lower access tools such as USSD and SMS, and 3, investments in DevOps for cheaper infrastructure at scale. Focus 2 is to increase therapy capacity in our operating areas. Based on feedback from our partners, we will build out online training capacity about psychological support, and 2, a group therapy functionality. Through 2021, these features will help us create an impactful platform for an estimated 50,000 beneficiaries. Our team has extensive experience in building mission-driven companies across East Africa and internationally. Additionally, on our team, we have leading mental health practitioners in Kenya and talented business professionals and engineers. Thank you for your time.